Otoplasties are relatively simple procedures to perform, but they have very profound, life-changing results. I'm Dr. Robbins, board-certified plastic surgeon at Des Moines Plastic Surgery, the world's leading clinic. Today, I'm going to talk about otoplasty and what it is and who are the best candidates. So what is an otoplasty? An otoplasty involves reshaping or setting back prominent ears. I would say there are different types of otoplasty in terms of what you're treating, but that's the most common that's treated. So there's two types of patients that come in for otoplasties. One usually comes in with their parents, and they're between 8 and 15 years old, and then the others are adults that come in by themselves. I would say both populations of patients wanting an otoplasty complain that the adult will say, it bothered me since I was a kid. I got teased and was very self-conscious even as an adult. And here I am as an adult wanting to get it fixed. Those that come in with their parents will say the same thing, but they're talking for their child. They say that they're noticing some teasing and some shyness in their child, and they want to be proactive about it. So those are very common around 10, 15 years old. How long does the procedure of otoplasty typically take? I would say on average, anywhere from an hour to 2 hours, depending on if it's both ears, which is the most common, and how complicated the surgery is. But on average, hour and a half to 2 hours. So what does recovery from an otoplasty look like? So most people don't return to school or work. A lot of kids will get this done in the summer or over a break. Most people have mild to moderate discomfort requiring pain medicine for a couple days, then switching over to Tylenol or ibuprofen, something non-prescription for pain management. We do ask that the patient wear a compression that kind of holds the ears in place after surgery. Those we want them to wear that pretty much all the time, except when they shower. They can shower in 24 hours, but we want them to put it back on and wear that all the time, even when they sleep for a week. And then after that, we still want them to wear it as much as possible, but for sure wear it at night. They do have to go back to work. So here's what to expect from start to finish. So of course you'll have a consultation with me, Dr. Robbins, and I will discuss the procedure, see what your concerns are, and examine the ear, show you before and after photos, show you in a mirror what's considered fixable and what's not. Go over the whole procedure, and then if it's something you do want to move forward with, you decide on a surgical date. These are done under general anesthesia. Sometimes we can do it under lighter sedation, but I would prefer general anesthesia. Most people do. The surgery is about an hour and a half to 2 hours, and then you go home the same day. Somebody has to drive you home, be with you the first 24 hours, and then we'll go over all the aftercare instructions. The main thing is just kind of taking it easy and resting and wearing your compression for that first week all the time, and then the remaining 3 weeks after that, just as much as possible, but definitely at night. Otoplasties are relatively simple procedures to perform, but they have very profound, life-changing results. You can learn more at worldsleadingclinics.com.